Hello, this is Milind working with RPIIT Technical and Medical Campus, Plaza, Karnal. In this video, I'm going to explain about risk factors for diabetes. These are those factors which can cause diabetes in a person. That means elevated blood sugar levels. So let's get started. First of all, risk factors for type 1 diabetes. Although the exact cause of type 1 diabetes is unknown, factors that may signal an increased risk include family history. That means your risk increases if a parent or sibling has type 1 diabetes because this is genetic disease. Next is environmental factors. Circumstances such as exposure to viral illness likely play some role in type 1 diabetes. Another one is the presence of damaging immune system cells. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes, but not everyone who has these autoantibodies develop diabetes. टाइप 1 डायबिटीज़ में होता है कि एक्चुअली जो हमारे बीटा सेल्स ऑफ लैंगर है वो डैमेज हो जाते हैं जो कि पर्टिकुलर अमाउंट में इंसुलिन सिक्रीट नहीं कर पाते और इस केस में भी ऑटो एंटीबॉडीज बन जाती है हमारा इम्यून सिस्टम ऑटो इम्यून कॉज कर देता है जिसकी वजह से बीटा सेल्स जो हैं वो डिस्ट्रक्ट हो जाते हैं और इंसुलिन इतना सिक्रेट नहीं हो पाता जो कि ब्लड ग्लूकोज लेवल को बैलेंस कर सके नेक्स्ट इज ज्योग्राफी certain countries such as Finland and Sweden have higher rates of type 1 diabetes. Next is risk factors for pre-diabetes and type 2 diabetes. Researchers don't fully understand why some people develop pre-diabetes and type 2 diabetes and other don't. It's clear that certain factors increases the risk, however, including weight. The more fatty tissue you have, the more resistant your cell become to insulin. Inactivity. The less active you are, the greater your risk. Physical activity helps you control your weight, uses up glucose as energy, and makes your cell more sensitive to insulin. One more is family history. Your risk increases if a parent or sibling has type 2 diabetes. Race or authenticity. Although it's unclear why certain people, including Black, Hispanic, American Indian, and Asian American people, are at higher risk, age also is a factor of diabetes. Your risk increases as you get older. This may be become you tend to exercise less, lose muscle mass, and gain weight as you age. But type 2 diabetes is also increasing among children, adolescents, and younger adults. Another is gestational diabetes. If you developed gestational diabetes when you were pregnant, your risk of developing pre-diabetes and type 2 diabetes increases because pre-diabetes is precursor of type 2 diabetes. If you gave birth to a baby weighing more than 9 pounds, that is 4 kilograms, you are also at a risk of type 2 diabetes. Next is polycystic ovary syndrome. For women having polycystic ovary syndrome, which is a common condition characterized by irregular menstrual periods, excess hair growth, and obesity, which increases the risk of diabetes. Hypertension or high blood pressure. High blood pressure over 140 by 90 millimeters of mercury, that is mmHg, is linked to an increased risk of type 2 diabetes. Abnormal cholesterol and triglyceride levels. If you have low level of high density lipoproteins or good cholesterol, your risk of type 2 diabetes is higher. Triglycerides are another type of fat carried in the blood. People with high levels of triglycerides have an increased risk of type 2 diabetes. Your doctor can let you know what your cholesterol and triglycerides level are. Next is risk factors for gestational diabetes. Pregnant women can develop gestational diabetes. Some women are at higher risk than are others. Risk factors for gestational diabetes include age, family or personal history, weight, race, and authenticity. Age. Women older than age 25 are at increased risk. Family or personal history. If someone is having genetic history of type 2 diabetes, it will it may cause diabetes in the person. Being overweight before pregnancy increase the risk of getting diabetes in future. Race or ethnicity for reasons that are not clear, women who are black, Hispanic, American Indian, and Asian American are more likely to develop gestational diabetes. So, these all about the factors which can cause elevated blood sugar levels in a person. I hope you like this video. Please do subscribe our YouTube channel RPIT Academics.